Hello, everyone. Welcome back to Andrew's YouTube. Today's episode is on vitamin D. So it's episode 7. My gosh, has the time flown by. Anyway, so why do we care about vitamin D? Well, for one thing, because its deficiency leads to a whole bunch of problems, and so does its toxicity. So, one problem is rickets, which was diagnosed in children, especially before we fortified foods with vitamin D. And as one news outlet reports, in just this past year, they're experiencing actually an uptick in rickets in Britain. And they think it has to do with kids spending more times on computers and indoors rather than playing outside in the sunlight and producing vitamin D. So, what is vitamin D? It's actually several vitamins that are sort of in different stages of activation. The most active form is vitamin D3, and a lesser active form is vitamin D2. So anyway, if you go to the doctor or something, oftentimes they give you vitamin D2 because it's less expensive, and it does sort of allow your body to convert as necessary. But vitamin D is also fat soluble, which means that it requires fat in the diet to absorb properly. It's typically found in the liver of animals and fish oils. It has a primary role in the absorption of calcium. And by the way, its deficiency doesn't just lead to rickets in children, it leads to bone softening in adults as well, and that's called osteomalacia in adults. So its different functions that we just mentioned, it helps absorb calcium. We know that it also has roles in the nervous system function, immune system, and muscular systems. Vitamin D is a prohormone, actually. It's a precursor to hormones, for example, androgens, the male hormones. And it doesn't mean that it actually acts like a hormone itself. It just sort of means that it's in it's required to produce these hormones. So it's like an intermediary. And it can also be produced through skin exposure to sunlight. Some people get it from their diet as well, and supplements in some cases. We know that it may reduce asthma symptoms, and there's also evidence to suggest that there's reduced mortality, or early death as it's called, and cancer risk. At least we think so. And there's probably a whole lot of other roles too that I'm not really considering. But if you're deficient, its technical name is hypovitaminosis D, super sexy, and it's defined as blood levels below 12 nanograms per milliliter. And some of the symptoms of deficiency include weakened bones, like rickets and osteomalacia, which we just mentioned, as well as the consequent bone pain and muscle weakness that accompanies that. Okay, so different risk factors. You're not getting enough from your diet. You're not getting enough sunlight exposure. Maybe it's the winter or darker months. Maybe you have a malabsorption problem, something's not working right with your gut. Celiacs and Crohn's disease are two examples of those that actually have issues with vitamin D absorption related to fat absorption issues. Because remember, we said it's fat soluble. Anyway, if you have kidney or liver dysfunction, like for example cirrhosis of the liver or chronic kidney disease, you might see some problems with your vitamin D levels. Also, some medications conflict with it. There's so many, so I'm just going to kind of leave that one to you and your doctor to discuss. If you are an infant who is breastfeeding, that's unfortunate, but breast milk is actually a really poor source of vitamin D. So they recommend provide them with a 400 IU supplement, or I suppose you could just put your infant child out into the sun to fry, but that seems a bit excessive. All right, now if you're an older adult, you're also susceptible for two main reasons. One is that your skin becomes less efficient at production of vitamin D when you expose it to the sun. And also in your gut, on the other end, you're not absorbing it from your food as well either because of inefficiencies that develop related to age. If you're obese, unfortunately, fat binds to and sequesters vitamin D and really prevents it from being utilized. If you've had a gastric bypass, part of that problem is that you have less capacity for food in your stomach, right? You've pinched it off. So less capacity for food equals less capacity for vitamin D containing foods. and hence you can have some issues, which is one reason why people with gastric bypass surgery are recommended to take a multivitamin. Also, to a lesser extent, granulomatous diseases like tuberculosis result in vitamin D deficiencies, and hyperparathyroidism is a big one. Hyperparathyroidism is an overactive thyroid gland, hyper, overactive. And parathyroid is different from your thyroid gland. It's actually sort of like exists alongside para, your thyroid. And what happens is when it's too active, you end up developing a buildup of calcium in the blood. And, well, for that matter, you can have other issues like calcium-based stones develop in the kidneys. So people with osteoporosis are at risk, and if you have dark skin. So all you pale people out there, myself included, consider that one of the benefits of being pale is that you produce vitamin D much easier than somebody with very dark skin. Okay, so too much of vitamin D is called hypervitaminosis D, and you can typically get it by following a 4,000 IU or greater vitamin D supplementation daily. Over a long period of time, that really becomes an issue. But just to put things in perspective, people can consume about 60,000 IUs of vitamin D daily for several months before they actually develop a toxicity. So you can imagine with 4,000 IU, it would take significantly longer and the right conditions. Anyway, it's defined in blood values as greater than 125 nanograms per milliliter. Recall that deficiency was less than 12, so you can see there's a wide fluctuation there. Pardon me, I'm sick lately. Some symptoms include nausea, vomiting, poor appetite, constipation, weakness, and weight loss. There's potential for kidney damage, as I mentioned, with the production of calcium stones. Remember that vitamin D raises blood calcium levels, and if it builds up, which is called hypercalcemia, can develop these stones. There's several different types of kidney stones that can develop. Calcium stones is one of them. And hypercalcemia symptoms include confusion, disorientation, pretty much describes me, I guess, every day, naturally, and abnormal heart rhythms. Some causes mainly are from vitamin D oversupplementation, like people who take these mega doses, or if they're on doctor prescribed dosages, usually injections or pills, that are much too prolonged. Most physicians are trained to reduce the vitamin D supplementation or to keep it to a minimum and steadily increase levels because of this risk factor. Okay, so we have something called the RDA, which refers to, it stands for Recommended Dietary Allowance. And these are these levels of certain vitamins and minerals that are recommended based on extensive testing in healthy adults. And it's thought to, an RDA is thought to fulfill the requirements for about 98% of the population of healthy adults. So just something to keep in mind, an RDA is a really good guideline. And you can see your needs increase as you get older here from this pattern. Most people, however, from children up to adulthood, typically about 600 IUs a day. That's 15 micrograms in case you were curious. But once you get older, remember that you don't absorb it as well, nor do you produce it as well from sunlight exposure. So that's why the higher need, 800 or 20 micrograms. Pregnant and breastfeeding women also require it. You should be getting that in your prenatal vitamins. And I think we already mentioned the asthma thing. So some food sources of it, egg yolks. And I gotta just say as like a little aside here, because a lot of people have heard over the years that dietary cholesterol raises blood cholesterol. What we know though, however, what we've known for probably close to 2 decades or more, is that actually cholesterol, dietary cholesterol really doesn't have a significant effect for most people on their blood cholesterol levels. The biggest factor tends to be saturated fat from animal products and coconut oil, that kind of thing. Anyway, so you can also get it from fatty fish, the livers of animals, as I mentioned, cheese, mushrooms, and I really can't emphasize this enough, fortified foods like breakfast cereals. You can get orange juice with added vitamin D and calcium. Dairy and its equivalents, like soy milk, for example, are often fortified with vitamin D. It doesn't really occur naturally in them very highly. So, what are my recommendations as far as vitamin D? One, I want you to shoot for the RDA daily. If that involves taking a basic multivitamin to ensure that you get it, then go ahead. But don't do a mega dose vitamin. Just a simple one a day or Centrum or their generic equivalents are fine. And just talk to your physician before you start a multivitamin just to make sure it doesn't conflict with anything and they approve, okay? I want you to get a blood test regularly. Yearly would be great. You are going to notice if you get blood tests that during the winter time, as we mentioned, the darker seasons in the winter tend to be a big risk factor. In the winter times, your levels are going to go a little bit on the low side, and your doctor may recommend that you take supplements or something to boost that. D3, like I said, is the most active form of vitamin D. So if you are going to take a supplement, uh, that's about as active as you get. That's about as high quality vitamin D as you can get from a pill. Is D3. It's a little bit more expensive though, which is one reason why your doctors will prescribe D2 most of the time. And you must ensure that you get adequate sunlight exposure. One thing we've been noticing from a scientific standpoint medically is that a lot of people are overusing sunblocks, which prevent the production of vitamin D, and so that risk is going up. Not to mention, if you live in those cold winter areas, especially above the Mason-Dixon line in the United States, you're just sort of making it worse. But those are my